As we said earlier in the show, there has already been one death in the U.S. due to the coronavirus, and there are fears the virus could spread further. Dr. Courtney Downes from the Elite Medical Center joins us now with more details. And of course, thank you so much for joining us this morning.
Thank you for having me.
Yeah, so there are a lot of fears now with coronavirus, but of course, the fear of the virus is spreading faster than the coronavirus itself right now. So what should people know about it?
So coronavirus, it's a virus that can cause respiratory symptoms, so coughing, shortness of breath, fever. The coronavirus is similar to the flu in that it's spread by respiratory droplets. So someone comes in, they cough, they sneeze, they blow their nose, and then someone else comes into contact with these germs and they become infected. So for the most part, it's being spread outside of the U.S., but we do expect that we're going to start to see some cases within the U.S. Similar to what we're seeing in California and some of the Pacific states.
Now, Elite Medical is actually right at the heart of the Strip, and you are also seeing a lot of tourists. So how has this affected the way you see patients and the way you change your protocol in terms of seeing patients?
Yep. So we do have a screening protocol in place at Elite Medical Center. So patients come in, they may complain of having fevers or cough or some other flu-like symptoms, and if they do report those complaints, then we ask about their travel history, and if they do report that they've traveled to China or any of the countries that are seeing higher cases of coronavirus, or they've been in close contact with any of these people, then we'll take the necessary precautions, put them into a special room and notify the public health department, so that way we can make sure that they're being taken care of, but also keep everyone else safe.
Yeah, the good thing is we don't have any confirmed cases in Nevada.
That's correct.
And there are ways for us to protect ourselves. So what are these ways again?
Right. So ways that we can protect ourselves, just like the flu or with any other respiratory illness, you want to make sure that you're practicing good hand washing. So soap and water. If you're coughing, covering your mouth when you're coughing or you're sneezing. If you're blowing your nose, you throw your tissue away and you wash your hands right away. Wearing a mask may be useful if you're having symptoms of fever, cough, because it'll prevent the spread of the illness. However, if you're not having any symptoms, wearing a mask is not useful, not going to be beneficial, may actually increase the risk of you getting an infection.
Now, these are just really simple ways, but these are actually ways not just to protect yourself from coronavirus, but other types of diseases out there as well, like the flu, even just the common cold.
Right.
Thank you so much for joining us this morning. These are really, really helpful tips and information. And of course, we'll be right back after this break.